you have a 1 in 4 chance of becoming a victim of an inaccurate injection. And that's if he's a skilled and experienced professional. So, what's the big deal about haphazard, inaccurate injections to your spine, you might be wondering? Well, just ask Dennis Capolongo. A nagging hip pain prompted Dennis to visit his medical doctor. After receiving just 2 epidural injections, he suffered 2 trips to the hospital, was hospitalized, and suffered non-stop back pain. That's not even the real tragedy. Dennis developed arachnotitis, a pain disorder caused by the inflammation of the arachnoid. That's one of the membranes that can easily be damaged as a result of blind epidural injections. He can no longer work or do anything he used to because of his condition. He describes the condition as, quote, sheer, hopeless hell. And there is no cure. Dennis invests the little strength he has now to warn unknowing patients like yourself of the horrific dangers of epidural injections. So, does this form of treatment sound like something you should gamble on? I think not. Now, let's just recap everything you've learned so far about the only drugs your doctor can prescribe for your back pain. Over-the-counter painkillers, which have been proven to erode the stomach, cause ulcers, and turn your liver toxic. Prescription painkillers, which also inevitably lead to dependence and addiction. Muscle relaxants, which will mask your pain while you do even greater damage to your back. And finally, the epidural spinal injections, which can leave you terminally sick, paralyzed, or worse. I hope you see that none of these are a wise choice to eliminate your back pain. With drugs out of the question, there is one more form of treatment your doctor may recommend for you to relieve your back pain: surgery. Now, before you jump at the chance to go under the knife, listen to what Dr. Arthur H. White, internationally renowned orthopedic spine surgeon and recognized leader in the field of spine surgery and rehabilitation, sadly admitted. Quote, "Exploratory surgery to search for the cause of a patient's pain is useless. You don't operate on a chronic patient unless the pain is intolerable, unless you know for sure that the pain is generated by a specific malfunction in the back and that surgery has been shown to correct this particular problem." Unquote. Again, for a surgeon to operate without knowing the exact cause of your back pain is useless. Yet, there's a good possibility this will happen to you, according to Dr. White. Dr. White reveals, quote, "I make my living on cleaning up the messes of other surgeons who have operated prematurely with inadequate diagnosis and inadequate training," unquote. Not only is back surgery a potentially huge cost for you, but it may be completely unnecessary and ineffective. According to William Abdu, an associate professor and director of the Spine Center at Dartmouth College in Hanover, New Hampshire, quote, "Spine patients are nowhere near normal when they walk in the door. Their spinal condition and other problems are so burdensome they don't function well. After back surgery, people don't return to normal and still have the psychological and social problems they had before back surgery," unquote. Repeat, if your doctor or surgeon even hints at the fact that you'll be, quote, "good as new," don't be fooled. Dr. Abdu regrettably admits, quote, "We can't make these people normal, that is, healthy with full function, and we shouldn't think we can. If any doctor is telling you this, whether they admit it or not, they are telling you a lie," unquote. Again, whether it's your surgeon, family doctor, or even friend or family member, Dr. Abdu, director of the Spine Center at Dartmouth, says it's a lie. If you happen to be a person with long-suffering chronic back pain, surgery will not help you. The Dartmouth professor of medicine discloses the truth when he says, quote, "We're not going to cure back pain by operating on 40-year-old people with 20 years of back pain. We can't cure them by operating on them," unquote. But most unsettling of all is not the surgery itself, but the aftermath of going under the knife. As shared earlier, statistics show that if surgery is required, 3 of every 4 workers will not return to work for up to